First thing we do is to check the doctor's order for catheterization. This is to ensure that we will be assessing the correct procedure to be done with the right patient. Okay, so wash hands before preparing the set. This is to deter the spread of the microorganism. Next, identify the patient and explain the procedure. So this is to inform our patient of the things that we will do all throughout the assessment. Good day, ma'am. I'm Jess Alfaro, your student nurse for today. So for today, ma'am, I'm going to perform a catheterization. And I'm going to expose your genital area. Will be that alright for you? Okay. Since you can control your urine and empty your bladder, I'm going to insert a catheter there. And this is how to drain your bladder, okay? Next is to provide privacy by screening or closing the groove. So, good visualization of the meatus is essential to introduce the catheter. Gravity will aid the flow of the urine when bladder is higher than the end of the catheter. Next is to drape the patient, exposing only the area to be used. So embarrassment and chilliness will make the patient become tense. Next is apply the direct light for visualization of genital area. So having enough light may interfere with the easy insertion of the catheter. So next, open the tray and arrange equipment for convenience and according to avoid contamination of a sterile item. So placing the materials in order will increase the speed of the procedure. Switching the sterile items will increase speed up. So this, I'm gonna use it for the So using a sterile forceps, cleans the area using a cotton ball with the betadine. Next, open the set and absorbing the stir technique and put on stir gloves and put the eye sheet on. So I'm gonna and put my gloves on. Next is to lubricate using the catheter for about 1.5 inches, being careful not to plug the eye of the catheter. So, pick up the catheter at least 3 inches from the tip of the thumb and place the thumb and one finger of the left right hand between the labia minora. Separate and pull up gently. So, separating the area surrounding the meatus provide visibility. So, insert the catheter into the meatus for 2 to 3 inches or until urine begins to flow. So, female urethra is approximate to 1.5 and 2.5 inches. So here, I'm gonna insert it to 2 to 3 inches. Okay. So next, first specimen is to be collected. Pinch the catheter with the thumb and the finger while placing the specimen container in a position. So urine will flow out the catheter if fluid is not occluded. So next, rest the hand and pubis area while holding the catheter in place to prevent the pulling and pushing of the catheter. So this is action prevents the possibility of the contamination of the urethra. So next, connect the catheter to the urinary bag. And I'm gonna insert this. So inflate the balloon 10 to 15 cc of sterile water and using a 15 to 20 cc syringe to make sure there is no leakage of the water from the balloon. Secure the indwelling catheter by tapping it into the patient's thigh. Allow some slack of the tubbing to accumulate the patient's movement. So this helps the catheter to secure the properly. Next, place the patient comfortably and do the aftercare and record the time of the procedure done, amount, and color of the initial output. Perform and hand hygiene. And lastly, document.